Hi, this is Frankie, and welcome to another episode of Behind the Drape. So today I'm going to give you 10 things to avoid before having anesthesia. Number 1, eating or drinking. You should never have anything to eat or drink before surgery. So usually we want 8 hours of NPO status, or nothing by orum, before the surgery itself, and we don't want anything getting from your stomach into your lungs during that crucial time during the induction period of anesthesia. Smoking. We want you at least to not smoke for 24 hours before surgery, but obviously with open procedures, we usually want 30 days of no smoking before the procedure because we want your wounds to heal adequately after the surgery. Alcohol consumption. For at least 24 hours before your anesthesia, it's very important that you abstain from alcohol. It can actually interact with a lot of the anesthesia medications that are given and cause dehydration, which is not what we want before we start the procedure. We want you adequately hydrated till the night before surgery, so if you consume large amount of alcohol, you can actually become very severely dehydrated, and we don't want that. Taking certain medications such as Advil, aspirin, naproxen, non-steroidal anti-inflammatory drugs, they can actually increase your chances of bleeding during surgery. So it's very important that you stop taking those medications at least a week to 2 weeks before surgery. Illicit drugs. Drugs like cocaine or amphetamines can interact with anesthesia and cause serious arrhythmias during the procedure. Obviously, we ask that you interrupt the use of any illicit drug use for at least 30 days before surgery. Usually marijuana, I want patients to stop the day before surgery, and they can resume 1 day after surgery. Heavy exercise. We want you to stop heavy exercise at least 24 hours before surgery because that can impact your hydration status. And as I've spoken about this before, we want you to adequately hydrate it, and excessive exercise 24 hours before surgery can actually dehydrate you. Over-the-counter supplements such as Herbal Remedies. Many of those remedies have increased your chances of bleeding during surgery. So we want to minimize bleeding as much as possible. So we ask that you stop those medications at least 30 days before surgery. Caffeine intake. You should stop your caffeine intake at least 24 hours before surgery because it can actually increase your heart rate, and that could be detrimental during your procedure. And by stopping 24 hours before surgery, we have the best chances of having you controlled during the whole procedure. Don't apply makeup, nail polish, or lotions before surgery. These things can actually interfere with some of the monitors that are going to be placed in you. So we want to be able to apply these monitors adequately, and we don't want any interruptions in flow. Remove all piercings and jewelry before surgery. They can actually cause infection, and sometimes when the bovie is used, they can actually cause a burn on your skin. I hope these little tips help, and I'll see you next time.